Hey everyone, I'm Nina. I work for Leeds Community Healthcare and I'm the Clinical System Pathway Development Lead. At the moment, I'm working with Diabetes Leeds to make sure that diabetes care is joined up across the system. And one thing what I'd like to do today is just talk through where we're at because we've been working with Hatch to try and address some of the challenges that you face when it comes to diabetes care. Now, I have managed to get some slides together, but computer's not playing ball, probably a bit tired. So if I just go through it and I can share the slides afterwards, and I would like to encourage you to discuss where we could go next in terms of diabetes care within your area. What more can we support you with to achieve the right outcomes? So right at the beginning of last year, we got together, we had workshops, and we wanted to make sure that we built on mapping, we built on existing success, that we raised awareness of diabetes, we improved communication, and we also talked about the opportunity of one-stop shops. So what have we been doing? So first of all, we feel that communication is one of the best ways to start addressing equity of care. And we have reserved some funding to improve the communications across the city for diabetes. So within Hatch, coming to your area soon, you will have some roller banners and you'll have some digital comms, and hopefully in some different languages. And you'll be able to display these both within NHS sites and local care partnership sites as well, your choice. And it'll be very, very much up to you guys to decide where is best to place them, and also rotate them around your area. Because mapping was also quite key, I would still encourage you to use your Leeds directory and make sure that your organisations are on there if you want to. And also promote your libraries. Now, one of the things that I was really keen to do, but at the moment, the way that funding streams happen is I've been unable to sort of coordinate diabetes care, as in NHS care, alongside community organisations. When that opportunity is more possible, I'll make sure that that happens. But we have been working with libraries. They are something that's centrally resourced, and it's sustainably funded. So we've worked with the library team to improve the quality of books that are in there and hopefully more culturally competent. And one of them is that we met Gloria down at the Reginald Centre, and she recommended the World Foods book. So we've got that one in there coming. The other thing is that we've also been working out in your community, spreading the word of diabetes. And we've done this through Unique, or Leeds Health Awareness. They've produced lots of drop-in sessions. They've also been checking blood pressure. And this works into the idea that we want to start creating one-stop shops. So we're starting to trial outreach support within communities, and I think that's great. We've been to loads of different venues. We've been to the Reginald Centre, Prince Philip Centre, Polish Centre. So we've been to lots of places and met lots of people within your community. We've also tried to encourage recruitment into the diabetes service as well within your area too. So lots and lots of good stuff there. We've also done a lot of work working with the homeless and vulnerably housed who are living or situated in your area. We've worked with Paphras, St George's Centre, St Anne's, and we've screened over 188 people. We've found people at risk of diabetes, and we've also found people with diabetes, and we've gone on to support them in their care. And a really exciting thing is that we were trying to screen diabetes risk through blood glucose monitoring, so random blood glucose monitoring. And we think that this could have some valuable opportunities within wider populations. So we've invested in some more glucose meters and some test strips and all the other stuff that goes with it. So I'm wondering whether there's any organisations within Hatch that would like to be trained on how to test, or we can come to you and we can reach out to your communities. We've already tried it with the Gambian Welfare Society, And we found 2 people with quite significant diabetes. Let's just say they had a blood glucose reading of 30. So we know that there's people out there that we know aren't accessing care, and we just wonder whether this opportunity of screening people is something that can be done within your community. So if it's something you're interested in, I'd be really keen to hear from you and see how we can work that up. The other thing as well is that we at Leeds Community have improved our website's accessibility, and I would say that do promote it to people. When you do access our website, it has the option to translate into many different languages. And on this website, there's some core information around eating well, physical activity, what to do when you're poorly with diabetes, and it also has British Sign Language links as well. So we would really encourage you to use that. In terms of diabetes prevention, we are really working hard to make sure that we have a healthy community. We're working closely with Leeds City Council, who are developing an active transport bid, and their focus is in Bermontoffs. So what we've decided is to connect diabetes and active transport together with this project. It's still in the development stages, but watch this space. The other thing I want to mention about diabetes prevention, something we're also working up, and it's people who've had gestational diabetes. It's the one cohort where about 50% will go on to develop diabetes. So I would really suggest that if you do come into contact with people and you can support them, encouraging them to access family centres, wellbeing groups, would be really, really beneficial. Doesn't necessarily have to be through those traditional channels of, the National Diabetes Prevention Programme. We know it's not for everybody. If you could, encourage your communities to lead those healthier lives, that would be great. We do provide structured education programmes for type 2 diabetes, and we have our current offer. It's online, it's face-to-face, and for those people that need it, one-to-one. What we would like from you guys in Hatch is to let us know where you would like us to position ourselves throughout the year. Are there particular centres that are very meaningful to local populations? So we have the Reginald Centre down as a regular, as part of our partnership work with the libraries. But if there's anywhere else, please do get in contact so that we can put it into our plans for the year. Okay. The other thing is that we have improved the information available on the Get Checked Out website, which is for people with a learning disability. But what I would say is that the easy resources that we have produced can work well for people who have lower literacy or where English isn't a person's first language. So we have different sections. We have it on pre-diabetes, diabetes. We have it on Freestyle Libre, which is that glucose monitor that sticks on your arm. And we also have it for foot care as well. So just bear in mind, you could use it for your learning disability population, but also where language is a barrier. We are also trying to introduce technology into diabetes care. And we've got 6 months access to pilot an app called My Diabetes. I'll be really, really keen for people within the Hatch area to try it, simply because I want to understand whether it's culturally competent. There are other apps, but they're incredibly expensive. So I really do want to get a feel for, is this one good, or should we really invest in some different technology? So to gain access to this app, essentially you need to refer people onto that LEADS programme, which is the Structured Education Programme for Type 2 Diabetes. And between April and October, people will have access to that if they want. Okay. In terms of diabetes education, in April 2023, we aim to have the diabetes courses, which are appropriate for local care partnership organisations to access. So again, watch this space. I'll send the links once I know more. And that is it, really. I'd just like to say thank you. Thank you to everyone in this local care partnership. It's been lovely working with you, and I think you're a really vibrant and proactive team, and you really are committed to supporting your communities, and it's brilliant. And I'd say we're really looking forward to working with you in 2023. So feedback is welcome. If there is anything that you think that we can do with the resources that we have and in a sustainable way, please let us know how we can start to support improving your population. Okay, well, I'll leave you to discuss all your ideas and things, and I'll catch you very soon. Okay, thank you very much.